Hey, thanks, guys. So our next session, really cool about retail and retail and medical, and how that's starting to converge together. And obviously, no better two people to talk about that than Qualcomm Life and Walgreens. I hear they had a big announcement this morning. I'm offline, so I'm going to read about it. But really excited to welcome them all to the stage, and I'm going to introduce our moderator. We actually have it is a last-minute addition and worthwhile addition. You guys can come on up. Greg Orr, he's the Director of Consumer Digital Health for Walgreens, and he's going to be moderating this session. So his New Year's resolution is to train for Mount Rainier in Yosemite. So next year, once again, we'll check in with you and see how that went. Thank you.
Wonderful. Thanks, everyone, for joining us. I sit here on the stage with two very, very close friends and absolute veterans in the digital health space, Dr. James Mault, who is our Chief Medical Officer for Qualcomm Life, and Mr. Adam Pellegrini, who is Vice President for Walgreens, of which I also work. So, gentlemen, let's talk about your big announcement. This week, Qualcomm and Walgreens building out a partnership, which has been announced and picked up in several articles. My favorite article that picked it up was actually Forbes, that said Qualcomm is getting into automobiles, light bulbs, and healthcare. So, Dr. Mault, tell us a little bit about that.
Well, let's see. Automobiles, there's a joke there somewhere. No. And forgive me, my voice is fading after 4 days of this. But, you know, we're all here this week and seeing the big story is clearly the Internet of Everything. Qualcomm has a long, proud history of enabling that wireless communication between our mobile devices, and between now and 2020, we're about to grow from somewhere in the range of 14 billion connected devices to, in the next 5 years, we'll be at over 25 billion connected devices. And the things that will be taking that growth are not, frankly, our handsets, but literally our automobiles, our light bulbs, and most significantly, I think, is healthcare, where healthcare is still in the emergence of its digitization, and we're very excited about the relationship and opportunity together with Walgreens. Many of you may know Adam and I have been joined at the hip trying to pull something like this off, first at Microsoft and then together at Healthy Circles and Greg along the way. So the three of us together, I think, are finally seeing the opportunity and the convergence of the consumer market, the medical market, and the technology enablement that makes this pretty exciting times.
Perfect. And Mr. Pellegrini, can I call you Adam?
Yeah, please do, actually. Okay. Mr. Pellegrini is my father.
Adam, let's talk about that convergence of these different areas and how now Walgreens, as a global company, is really taking part of that, and what role that Walgreens plays as a pharmacy and health services delivery company.
Well, Greg.
You can call me Greg.
Thank you. I appreciate that. So, you know, Walgreens, obviously, we are, as you know, very focused on delivering the ultimate convenience, along with making sure that we extend the role of community pharmacy. And what does that mean? It means that for over 100 years, pharmacists have actually been doing more than just putting pills in a bottle. They have been answering questions. They have been taking care of educational needs for diabetics. As you know, the pharmacist plays an essential role in the care team. And this evolution of connected health is really the hope and dream of what I always refer to as omnichannel digital health. And what do I mean by that? Omnichannel really is this concept that you can deliver care online, and go offline and go back online, and you could do so in a way that keeps everything seamless and frictionless. So when you deliver omnichannel care and omnichannel health, you can actually deliver care where the person is and where they want the actual service. So I think it goes back to the core of what Walgreens has always done. And at the end of the day, if we put the patient in the center, it shouldn't matter where they get the health information, the resources. As everyone knows, we also launched a big announcement with WebMD, who we're all working with as well. Once we all work together and put that patient in the middle, that is the perfect convergence of technology and patient centricity that allows us to deliver care that's seamless and frictionless. And so really, technology is an enabler, it's an extender, but adding on the offline element brings about a full picture. It brings up the full ability of what Walgreens and Qualcomm and WebMD and a lot of our other partners we can all do together.
Perfect, yeah, and convenience being something that we expect in every other industry. And for some reason, in the healthcare, we seem to accept that it's not convenient, and trying to change that for the world is definitely very important. And you talked about the technology a little bit, and Dr. Mault's been in kind of the connected device before they even called anything wearables or even called things connected devices.
With the Palm Pilot.
With the Palm Pilot and probably prior to that. So tell me, Dr. Mault, how things have evolved, and is this the perfect time as the technologies start to mature and to be able to support this type of service in the healthcare industry?
Well, we're excited about the technology, and that's a lot of why we're all here for this meeting. The technology is an enabler, and as we talked about, some of you, I was reminiscing about being here at CES 15 years ago this week, exhibiting in the Palm Pilot booth. Anybody remember Palm Pilot?
I have one.
I had a 3C, the color one.
So we had the very first health application on the Palm Pilot that could bidirectionally communicate with a desktop computer and, amazingly, an internet application back 15 years ago. And so we've come a long ways. What's changed? Well, obviously the form factor, there's no more cables, so wireless, again, is instrumental in reducing that friction. But at the same time, while our 2net system from Qualcomm Life is now enabling the device connectivity to those blood pressure meters and medical grade devices that are going to be important for delivering care. That's just one piece of the puzzle, and I think the exciting thing about medical and retail coming together in the form of what we're talking about between Walgreens and Qualcomm Life is that it's not about the devices, it's not about the technology, it's really about being able to deliver care right into the home. And we've got a healthcare system that is in the process of changing its fundamental model from fee-for-service to value-based care. Well, what does that mean? Well, it means doctors used to get paid only when you went to see the doctor in the clinic. And so even going to the pharmacist out of their business model only got paid to count pills and put pills in a bottle. Now that's all changing. Now you're going to see the role of the pharmacist and the opportunity for retail, if you will, to start being an instrumental part of the care delivery system where they're actually doing a significant part of the care. And these technologies are enabling technologies that will allow them to have the information. They're not sitting in the hospital, they're sitting in the retail pharmacy. And now these devices and this information and these interactions with patients remotely in their home at their convenience. We heard all about the take care clinics and the retail clinics changing the dynamic so you don't have to wait a day for an appointment with a pediatrician to get a strep test, and being able to go conveniently down the street to a Walgreens, get a rapid strep test in 5 minutes, and now you know whether or not your kid can go to school. Now imagine you don't even have to go to a physical Walgreens. You should be in your home and be able to do home diagnostics, whether it's strep test or other things. Walgreens doing really innovative things on the laboratory and diagnostic side. Maybe we should talk about that. But the bottom line is, pharmacists are now going to be able to practice at the top of their license. They're one of the most underutilized resources in our healthcare system today. And we're very excited as Qualcomm to be a technology enabler for those types of new models. And it's also fun. I'll also bring up another softball, which is MD Live. We as Qualcomm employees have been using MD Live for several years now as an employee benefit, and it'd be fun to talk about how even the MD Live physician consultation would potentially be able to take advantage of home blood pressure measurements and so forth.
Yeah, and I think that's my cue. We saw telemedicine as a natural next step in delivering virtual care. A lot of people may not know this, and I'll throw out stats because I like numbers. I like numbers, and I like to be very real about adoption. So our pharmacy chat, which is on our Walgreens mobile app, if you open up the app and you'll see a little chat icon, gets between 9,000 to 10,000 chats a week with consumers. There's actually blog posts out there of moms that live 37 miles from a Walgreens and from their nearest healthcare provider that simply want to ask a question about a medication, and they're using the Walgreens chat. That's step one. That means, people are starting to get used to this idea of being able to use their mobile phone to ask simple questions. That's great. Step two is, how can I now, that same person, I always tell this story, everything I do in healthcare is rooted in some type of history or past experience. I was a combat medic in aviation, a surgeon's assistant, working for people like you. And the story that I always tell is in this gold mining town called Yellow Pine, Idaho. My neighbor actually had to drive 67 miles on a one-lane road, an old mining road, just to go into town to have the lesions on his leg checked twice a month. The treacherousness of that road, the treachery of that road, is far, far more dangerous and potentially fatal than probably not going and getting that checked maybe once or twice a month. But shouldn't he be able, I thought to myself, to be able to take his phone and just have the people look at it and then say, yeah, you probably do need to come in. It's simple use cases like that that just make sense. So when we launched telemedicine, we were thinking about that convenience and simple use case from day one. We also chose MD Live for a very specific reason. They have partnerships with local health systems. Walgreens sees themselves as a member of the care team, as opposed to trying to deliver care themselves everywhere. So our model is absolutely about partnerships. Because at the end of the day, it's going to take a provider, it's going to take a local provider, it's going to take a pharmacist, it's going to take everyone working together to deliver that care. And so as we go forward, the next evolution, so we do everything in evolutions, the next evolution is going to be remote monitoring. Why can't we not use exception management to deliver better care to more patients at a fraction of the cost? Sorry, I had to steal your line one more time. I won't do it again. But it's true, right? I mean, we want to be able to really take a look at the population level health. This is also why on the non-chronic side, we launched the digital health assistant from WebMD, integrated into Walgreens.com. Now, let me be really clear. This is one of the coolest things that I've worked on in about 10 years, because we've taken a payer-based, I said one.
Didn't you help me build
said
healthy?
one.
Oh, one of the.
One.
Okay.
Healthy Circles was, come on, it's all over the place. One of the coolest things, because we took a B2B digital coaching platform, and we integrated it into a direct-to-consumer portal that has never had a coaching, longitudinal coaching program ever offered on it before. And we're getting people signing up left and right, and it's really rewarding. So we know we could do the same thing on the chronic side and looking at the remote monitoring piece. There you go.
Beautiful.
And Dr. Eric Topol, well-known author, talked about remote monitoring. His first book, The Destruction of Medicine, Creative Destruction of Medicine, and it kind of started to think about the different ways that hospitals are going to be reacting. So Dr. Mault, as a physician, how do you think that the physician's world is going to be changing over the next 5 years, 10 years, and beyond with these connected devices, and what's going to change? Even from so much has changed from the 50s to now. What's going to happen now as we go forward?
Not that you were there when that change happened.
No. Well, 2015 is huge for what's changing in the world of physician in this regard. We've been living in a healthcare system in the United States that had a foundation based on what are called perverse incentives. And that had to do with the fact that we had insurance offered by employers in the 1940s and 50s as basically a perk to entice employment after World War II. And suddenly we created a system where I, as a patient or as a consumer, could go see a doctor anytime I wanted, and the doctor got paid, and the patient didn't have to pay for it. It came from somebody else, and the same for hospitalization. So we built this runaway train where the incentive became the more patients I see in the clinic, the more revenue I generate, and all of our hospitals focused on keeping our beds filled, and as many patients we can admit each day and each week and each month, the better. Now we're going to a new system that's value-based for, I think, all the right reasons. And the world of the physician is suddenly changing because in a value-based world, the more somebody gets admitted to the hospital or goes to the emergency room or even shows up in my clinic, the less money anybody is ultimately going to make to pay their kids' college tuition. And so all of the new incentives are aligned to do whatever it takes to keep you healthy and out of the hospital and healthy and out of the clinic. And what does that mean? Well, it means hospitals and physicians and allied health personnel are all motivated to monitor you, check on you, keep you healthy and in your home as much as possible. So they're now seeking out, and this is what's changed from even 12 months ago, is the era when it comes to telehealth and remote patient monitoring, the era of what I came to know and we all experienced as death by pilot is finally over. And what we're seeing are legitimate enterprise-wide, health system-wide rollouts, not pilots, not can you do this free for 100 patients, but we're ready to roll this out system-wide, and we have budget and we have a mandate because we have to keep these patients out of the hospital and do it as much as possible with these patients in their home. So the one thing that kind of put that over the top was the announcement of something called Chronic Care Management, CCM, which we've been working on and a number of others in a coalition for years to get funding, literally over $5 billion of new funding or more for physicians to get paid. For the first time in the history of our U.S. healthcare system, physicians will be able to get paid without actually seeing the patient face to face. That is the biggest breakthrough in 50 years in the area of telehealth. And what that does is it opens the door to the incentive to, hey, I don't have to see you, but I'm going to be able to monitor you, your blood pressure and your glucoses and get paid for it.
Yeah, and I think I would feel bad if we left this session by not answering one of the actual key questions about retail. And retail is an amazing it's an amazing area to be in, specifically right now as it relates to healthcare. And the reason why I say that is retail has found masterful ways of unlocking adoption and getting adoption. And what is nice about this is, our rewards program, our Balanced Rewards program, has over 82 million active users in the program. We've only had the program for several years. And if we could harness that loyalty type strategy to drive the much needed patient engagement so that we don't have DOPs, or death by pilots. I'm not sure if that's a DVP, death. There you go. We're going to come up with lots of acronyms up here. It's already up on Wikipedia now. So really, can we drive that patient engagement in a way that has never been done before? Our Balanced Rewards for Healthy Choices program, we have over 150,000 people connected to devices right now, much more than that actually, and using them every single day. They're getting points, and the points are actual 1,000 points equals $1. So it's meaningful, small rewards every single day that drives this type of adoption and use. And really, getting away from the let's do a pilot of 10,000 people or 20,000 people, and how do we get it at an order of magnitude that hasn't been done before so that it starts changing population behavior. And I think that's where retail really can play an important part. It's going to be just a member of the care team, but the real true intrinsic assets it brings to the table, it's its ability to engage consumers. And the obsession, and it truly is an obsession, I can tell you this right now, there isn't a moment that goes by where we do not obsess about a frictionless experience for the customer. And if we can do that in healthcare with rewards at scale, imagine what we can do. We can transition out of the death by 1,000 pilots into truly large-scale implementations.
Wow, 150,000 devices. So that's incredible. And anyone that's
and thank you for sounding surprised, because you actually run that program.
But and anyone that's been, I think even the term wearable got legitimized at the last CES, in my opinion. My mom wouldn't know what a Fitbit or even what the word wearable meant until the last CES just came out. And then anyone that's walked the floor has seen all kinds of devices from socks to motorized belts and all these other things. So let's talk.
Do you get points for motorized belts?
Motorized belts?
A motorized belt that tracks your waist.
I'm surprised you don't have.
It's called Belty.
Do I want to know?
So let's talk a little bit about that. We know from devices, we've seen phones and how they've evolved. And if you look at an old phone from 6 years ago, it really looks funny to us. Let's talk about those devices and their legitimacy as far as healthcare versus activity, like in the Balanced Reward program, and how you see that evolving and being used, for true clinical use.
And also, because it's 2015, where's our hoverboard?
Where is the hoverboard?
Exactly.
Back to the Future, anybody? Wasn't that Back to the Future 2?
Yes, it was.
Yeah. That wasn't as good as 1.
Or 3.
Oh, 3
Sorry.
3 was awful. Sorry. He has a DeLorean, by the way, if anybody didn't know that. He drives it to work every day.
That's
his own DeLorean.
Except for in the snow.
Oh, okay. All right. We digress. This is really important because if we're going to do this, if we're going to take care of patients, we're going to manage their medications and tell you to increase your blood pressure medication because of home measurements. The technology has to be sound. The clinical accuracy of a blood pressure meter matters, and it matters even more if that's going to be used in the hands of a consumer in their own home. And so I think you're going to start to see kind of the importance of the medical grade start to declare itself. And I think there's a lot of consumer level products, and the fitness and wellness market isn't held to the same level of concern because, frankly, we're not changing your medications based on some of those measurements. But now that this makes a lot of sense, and frankly, the ROI, the financial opportunities for home monitoring is really, you're going to see those in the sicker tier patients. Then the not just the medical accuracy and medical grade device categories, but even the privacy and the security measures, the HIPAA level issues, whatever those may be, as well as the data integrity, ensuring that if this data was generated by that blood pressure meter, that it's not somehow modified or edited by the patient, and then it gets into the hands of the doctor and we're making the wrong recommendations.
So it sounds like there's a klaxon red alert siren going on right here, and I think that means that we're out of time. So we'll segue here.
Wait, is it not flashy enough for you?
Yeah, I've been missing the actual noise, but.
Do we want to
close out?
Any kind of final? We didn't have time to talk about drones. I really wanted to get into drones. Well, maybe at the sidebar over here.
Let's just say maybe next CES. I'm just joking. That sounded provocative.
Yeah,
yes, Walgreens and drones, absolutely. I'm in.
Twitter just exploded.
You're going to have beehives?
Any final thoughts around the partnership and kind of what's to come from the Qualcomm and Walgreens partnership?
Yeah, absolutely. I think what you'll see is our constant evolution of how do we evolve our connected device space? How do we grow adoption and fine-tune our reward strategy? We're already seeing elements of behavioral change come out of that program, so that's very exciting. I think as we start looking at true implementations of omni-channel remote monitoring, that's where we'll start seeing happen in the next coming 12 months.
Dr. Mault?
Yeah, I mean, we're, again, the marriage between medical and retail is so critical. You know, we're very excited in this relationship to be able to adopt those balanced rewards programs into our ecosystem and create opportunities for our device ecosystem to have, you know, those incentives for patients to monitor. But I think, you know, what this is a statement that none of us can do this on our own, and what you're seeing now are coalitions coming together between, you know, global giants who recognize this is a now moment. It's a land grab, and we're bringing together the core competences from the you know, retail pharmacy side and the wireless and medical side to really move the needle.
So cool. Sorry, really excited.
Thank you very much.
Love it.
Thank you.
All right, thanks everyone.
Thank you.